Let us talk about tuberous sclerosis complex. It is the neurocutaneous syndrome characterized by the formation of non-malignant hematomas and neoplastic lesions in the brain, heart, skin, and kidney. There are four major pathologic features of tuberous sclerosis complex. They are cortical tumors, subependymal nodules, white matter lesions, subependymal giant cell astrocytoma. The diagnosis of tuberous sclerosis complex is definite if we find two major features or one major plus two minor features. The diagnosis is probable if we find one major plus one minor features. The diagnosis is possible if we find one major or two minor features. So, what are the major features of tuberous sclerosis complex? Some are identified clinically, such as three or more than three hypomelanotic or ash-leaf macules found in 97% cases, facial angiofibroma found in 75% cases, or forehead plaque found in 15 to 20% cases. Sjogren patches 45 to 50% cases can be found, and there are some other clinical clinical features that are major diagnostic criteria. So there are some major features that can be found on imaging, such as subependymal nodules found in 98% cases, cortical tumors found in 95% cases, cardiac rhabdomyomas 50% cases, renal angiomyolipoma 50% cases, subependymal giant cell astrocytoma 15% cases, lymphangioliomyomatosis 1 to 3% cases. And the minor features, there are some minor features that can be identified clinically, and there are some minor features identified on imaging, such as white matter hematomas, radial migration lines 100% cases, hematomatous rectal polyps 70 to 80% cases, non-renal hematomas 40 to 50% cases, bone cyst 40% cases, renal cyst 10 to 20% cases. On imaging, the cortical tumors, subependymal nodules, white matter lesions, subependymal giant cell astrocytoma can be shown. Cortical tumors are broad expanded gyrus. On CT scan, they initially hypodense. Calcium increases with age. 50% of patients eventually develop one or more than one calcified tumors. On MRI, the periphery of the tubers, cortical tubers, are iso-intense, and the subcortical portion of cortical tubers on T2 or FLAIR images are hyper-intense. The subependymal nodules on CT scan, we may see calcification. It is rarely seen, the calcification rarely seen in first year but increases with age. 50% eventually 50% of subependymal nodules eventually calcify, but subependymal nodules do not enhance. On MRI, subependymal nodules appears on T1 weighted images as hyperintense and T2 weighted images as hypointense signal, and 50% cases subependymal nodules enhance on MRI. White matter lesions on T2 or FLAIR images are hyperintense radial lines or wedges. Also, there may be CSF-like cyst in deep periventricular white matter. How the Subependymal giant cell astrocytoma appears on CT scan. It appears as mixed density mass at foramen of Monroe and it enhanced moderately. On MRI, subependymal giant cell astrocytoma is heterogeneous and it enhances strongly. And there are some other miscellaneous lesions that can be found in tuberous sclerosis complex, such as vascular lesions, usually fusiform aneurysm seen in 1% of cases. And there are also parenchymal calcification in tuberous sclerosis complex. Thank you for listening.